this video, we're going to talk about the impact of hydration on your autonomic nervous system function. In particular, how to manage the what, when, and how of fluid intake to regulate and improve your autonomic nervous system function, improve your heart rate variability, and ultimately improve your symptoms. As a baseline, we should have somewhere between 2 and 3 liters of fluids a day. And when we're dehydrated, it gives an additional stressful trigger into the autonomic nervous system, something we should just take away as part of the continuing inputs to trigger the autonomic nervous system into a fight or flight mode. Patients with complex chronic illness may be susceptible to orthostatic intolerance, which is a condition which is characterized by getting worsening symptoms when standing up. Now, if you are one of those patients who frequently feel a lot worse when standing, for example, if you develop palpitations, shortness of breath, or lightheadedness when standing up, fluid management is going to be critical in improving your symptoms. This is because when we stand up, there is a gravitational shift where blood is pulled down from the head, from the heart, which are the core circulation bits, into the lower limbs, which are huge reservoirs of blood. And as the blood empties away into your lower limbs, what you can experience is activation of the fight or flight response, because the body doesn't like to be dehydrated and the body doesn't like to be in a situation where it has to experience low blood pressure states. With the sympathetic activation, you can then experience palpitations, shortness of breath, dysfunctional breathing, dizziness, lightheadedness. So fluid management in this context is very important. How should we apply fluid management? So what should we drink? And how should we drink? And when should we drink it? We should drink fluids, so plain old H2O, which is the very basal level of fluids that we should drink. And ideally, fluids should be drunk first thing in the morning or front-loaded. And why front-loaded? Front-loaded is this concept that you take the fluids to empower yourself for the day ahead, between 500 mils to a liter by breakfast. The other aspect of fluid management goes with respect to understanding what to drink. So I said H2O or plain old water, but if that is not tasty enough for you, then you could add a bit of salt and maybe a bit of cordial, but I would avoid in the majority of patients any strong caffeinated drinks. I also advise isotonic electrolyte tablets, and these are specific tablets that you can drop in your 500 ml bottle or glass, which fizzes up and gives you what's called an isotonic solution, which is the same concentration as your blood in terms of its sodium, potassium. And when you drink this, the distribution or the absorption and distribution into your blood supply is very rapid. So in some patients who are particularly affected, I get them to pop one of these isotonic electrolyte tablets before they get up in the morning. I might not ask patients to take much fluids beyond dinner time, let's say 7 or 8 o'clock. Because what we don't want to do is for a patient to not drink anything all day and to feel at the end of the day, they then have to drink the 3 liters worth and consume it all at dinner time and then have to wake up once or twice a night to pass that water out. So we've got what to drink, how to drink it, which is front-loaded. Third thing is how to drink it. Now, in a patient who is about to engage in activity that you know will be physically challenging, it's useful to drink your fluid as a bolus. So quite a quick shot of fluids, if you like, if you can consider 500 mils a shot. But you try and gulp it all at once or in a very short time, and ideally cold fluids as well. And the reason for cold specifically is because the cold allows for some vasoconstriction and they allow us to have a bit more blood pressure. So not only are you getting more fluid in because you're taking it externally, you're increasing the core circulation by squeezing the blood vessels with cold to get more blood back to your heart. So to recognize your level of hydration or dehydration, I think it's important to pay attention to a few things. One is the color of your urine. It should be a pale yellow color. And if it's getting any more deep or darker than that, you're likely dehydrated. The second thing is to feel your mouth and the tongue, how dry it is, because dehydration often expresses in the tongue. And the third is to look at your skin, the plumpness of your skin and the dryness of your skin. And those are the three things you could do to assess your dehydration. The easiest would be, of course, to check the color of your urine. So to recap, I think we should focus on the role of hydration in improving your autonomic nervous system health. In particular, when you hydrate well using the principles what to drink, when to drink, and how to drink your fluids, and how this will have an overall beneficial impact on your autonomic nervous system and heart rate variability, and ultimately improve your symptoms.